This is Dominic, and today I'm talking about Lumbrokinase. We're comparing it to Serrapeptase and Nattokinase. That's a lot of kinases, benefits, side effects, new studies, and we're starting now. There are so many studies coming out about Lumbrokinase, Nattokinase, and Serrapeptase. Improved circulation, peripheral neuropathy, safe and tolerable. The results look good. Cardiac fibrosis, stroke, lung problems. There is a lot of studies. Are these too good to be true? So health warriors, welcome. I did not know much about Lumbrokinase, Serrapeptase, Nattokinase until about last year. Even Lumbrokinase, a viewer brought it up to me. I am so thankful for you guys. You guys are on top of the newest studies, newest research, and that's what makes you health warriors. So thank you for watching. Thank you for being part of the team. And if you haven't subscribed, and put a comment down below. Lumbrokinase is an enzyme derived from earthworms and has been traditionally used in Chinese medicine. It is known for its fibrinolytic properties, meaning it helps dissolve blood clots and improve blood circulation. I did a video recently how blood clots are more common than ever. Over the last few years, they're shooting up, and it's not just viruses, it's not just medications, but we're moving less, we're watching more TV. On average, there's more medications that we're exposed to. There's more things in the environment. And we go over that in detail and specifically why it's happening, what to do about it, how to look out for a blood clot. Blood clots are clumps that form when blood hardens from a liquid to a solid. They can occur in the arteries or the veins and lead to serious conditions like stroke, heart attacks, and pulmonary embolism, which could be one of the worst things. Blood clots in the lungs are called a pulmonary embolism. Me, as a foot doctor, I see this a lot. People come in with a red, hot, swollen calf muscle, and this is something called a deep vein thrombosis. There's two ways to think about blockages. You have your arteries, which bring your blood flow from your heart to your toes, and then you have veins, which bring your blood flow from your toes up to your heart. Essentially, arteriosclerosis, atherosclerosis, calcium buildup happens in your arteries, which are the big, thick, rubbery hoses that bring blood flow down to your toes. But veins are a little bit thinner, and they carry slower, less pressurized blood up to the heart. In your veins, you can get blood clots that can plug, that can go up. In your arteries, it's more thickening of the vessels, fat, atherosclerosis buildup that limits the blood flow from getting down. That's how I like to think about it, although you could have a clot in the artery as well, for sure. A deep vein thrombosis is a blood clot that develops in your veins on the way back up to the heart. And this would cause swelling, pain, redness, warmth in the leg. And this usually happens some type of inflammation or irritation in the cells lining the vein, and your blood clot attacks it and builds up, and the clot gets bigger. The dangerous part is if that clot breaks away from the lining and shoots up to your lungs, when the vessels start to get small again, it can plug those vessels and stop your lungs from getting blood flow. A stroke, on the other hand, is if it plugs your brain. In your brain, if you develop a blood clot that can plug the hole, it cuts off your brain from receiving blood supply. This can cause sudden numbness in the face, arms, leg on one side, confusion, trouble speaking, understanding speech, or vision problems. Me, I don't deal as much with strokes. I deal a lot with deep vein thromboses. Diagnosing a blood clot. Specifically, a deep vein thrombosis in the leg involves the combination of clinical assessment and medical imaging. What I do when somebody comes in, you check. Is it equal on both sides? So for example, if both calves are swollen equally, it's probably not a blood clot. The odds that you have a blood clot in the exact same spot in both calf muscles is probably rare, although nothing's ever 100%. The deep vein thrombosis includes swelling, pain, redness, warmth on the affected leg. So for example, there's a test called the Homan's test where you squeeze the calf muscle and it hurts on one side. You want to think a clot. If it doesn't hurt on the other side, probably not a clot. But at the same time, you could have strained that muscle. You could have pulled something. It's not always this easy, but usually it is for me. When somebody comes in after an injury, a surgery with high risk factors, one leg is much more swollen than the other. And what happens is you can bend that foot up, and as that moves that calf, it's painful. I mean, really painful. You could squeeze that calf. You could push with your fingers on that clot area, and it's really painful. Not that that's 100%, but that's what makes you want to get a venous ultrasound test at that point. And you can go to any ER. They will squeeze you in immediately because this is considered something a little bit more urgent. Or you could go to a vein clinic. They will do this for you as well. And it looks just like this. My goal in these videos is not to get into politics, but to help people. Blood clots are a major contributor to our health issues, and look at our expected lifespan in America. This is terrible. We've got to do better as a country and around the world. I have a dream that these videos can help more and more people, so that's the sole intent of this video. So hit up the likes, hit up the comments, and help these videos get more reach. But that's why people are searching for things like Lumbrokinase, Serrapeptase, and Nattokinase. And you know what? The Google searches on all three of these are like almost 50,000 per month in the United States. These are extremely high. The supplements are actually selling really well. And in the previous videos on Serrapeptase and Nattokinase, people have had really good results. They've actually checked their blood levels before and after, and people are reporting some changes. Lumbrokinase is being studied in conditions such as deep vein thrombosis or a blood clot, ischemic stroke, and myocardial infarctions. It's also for sale as a supplement, and you can see there's some good reviews. There's a lot of sales of this supplement. It also shows promise in areas like neuroprotection, stroke rehabilitation, supportive therapy, and cancer treatment due to the inability to inhibit cancer cell migration and invasion. How does Lumbrokinase work? Well, it's considered to be a fibrinolytic powerhouse. Fibrinolysis is the process in which blood clots are dissolved. Lumbrokinase exerts its fibrinolytic effects by directly degrading fibrin and inhibiting the activity of something called the plasminogen activator inhibitor, or PAI1, a protein that inhibits the conversion of plasminogen to plasmin. Plasmin is an enzyme responsible for breaking down fibrin and dissolving blood clots. Lumbrokinase consists of a series of enzymes that work to break down the fibrin and prevent the formation of blood clots. Unlike pharmaceutical anticoagulants, Lumbrokinase offers a more targeted approach by specifically targeting fibrin and minimizing the risk of excessive bleeding. In the studies, it's been described as a safe alternative for individuals who may be at a higher risk of bleeding complications. The side effects of Lumbrokinase. Regarding side effects, Lumbrokinase is generally considered safe with fewer side effects compared to other supplements. Common side effects include dizziness, nausea, headache, constipation, and skin irritation. However, these are considered to be very mild and tolerable, and in a lot of the studies, nothing too major is reported, save for severe allergic reactions, which are extremely rare. And the thing is, anything you put in your body, anybody could be allergic to, especially with contaminants out there. Remember, these things are not necessarily FDA approved or studied, even though that's taken some hits in public opinion as well. Lumbrokinase can cause gastrointestinal disturbances and has potential interactions with medications, especially those affecting blood clotting, such as warfarin and aspirin. So if you're on blood thinners, just be careful, check with your doctor. It's advisable to stop taking Lumbrokinase at least 2 weeks before any planned procedures or surgeries to prevent excessive bleeding. Lumbrokinase dosage. In terms of dosage, the recommended amount for adults generally ranges from 20 to 30 milligrams, taken 2 to 3 times daily on an empty stomach. However, the optimal dosage can vary based on individual factors like age and health status. For certain health conditions, the dosage might be adjusted accordingly. So let's take a look at the specific Lumbrokinase studies. There is a big study actually going on right now called the Lucent trial. This is a large multi-center randomized control trial involving 220 participants between age 35 and 85 to look at stroke rates. This is ongoing, but this is going to be a high-level study that's going to take a look at this. The results should be in over the next year or two. It's not done yet. They just started this. Looking at it, that's probably the highest level study going on right now. But again, Lumbrokinase, it's a little bit of a newer treatment option. The second study I looked at investigated the impact of Lumbrokinase on pulmonary embolism risk. 60 patients were divided into two groups, one receiving lumbrokinase with heparin and warfarin, and another group receiving only heparin and warfarin. So they didn't count just lumbrokinase on itself, but they added it to a group of 30 people. They studied this of daily dosages for 30 days, and they measured essentially how much of that clot resolved. The results indicated significant improvements in the lumbrokinase group compared to the control group, suggesting the combination of lumbrokinase with other anticoagulants could be a safe and effective treatment for treating acute and moderate risk pulmonary embolism. That's when you have a blood clot in your lungs. There are actually a ton of studies about lumbrokinase. There's one about improved circulations and peripheral arterial disease where people could walk further, had more energy. They did a study about rats and peripheral neuropathy, which was beneficial for the rats. It's shown to be safe and tolerable. People had better cardiac fibrosis after a lifetime of smoking. It reduced stroke rates. Fibrinolysis or lung breathing was improved in other studies. Now, are these all massive studies? They're not, but they do suggest that bigger studies need to be done. And this does show a lot of benefits for sure. Is from silkworms. So silkworms, I didn't know much about these, but these look pretty cute. They make silk. There's some nice pictures of them. And I do talk about my one magical food, natto, which has nattokinase in it. This is made by fermented bacteria, and this makes an enzyme that can basically chop up and break up blood clots. It also has vitamin K2, which has shown to be heart healthy and cardiovascular health. There's dosage units for serrapeptase and nattokinase. And the tricky part with these is there's no standardized dosages. Essentially, if you eat natto, the Japanese bean dish, you don't know how much is in there because the fermentation process differs. Same thing with serrapeptase. It's made in the gut of the silkworm. That's a little bit different. You know, there's different size silkworms that can make different amounts. And we're going to talk about if our body actually digests these things. What is serrapeptase? This is an enzyme derived from the bacteria Serratia E15. It's found in the intestines of the silkworm. So it's not even the silkworm, it's the bacteria in the belly of the silkworm. So serrapeptase is proven as an anti-inflammatory. It's known for pain reduction and can be used for pain management, particularly after surgery. It can reduce swelling, helps reduce swelling and edema. It can help with mucus clearance, assists in clearing mucus from the respiratory pathways. The dosage depends on the condition being treated, but typically ranges from 10,000 to 30,000 serrapeptase units. Again, that's just something specific to serrapeptase. So the pros and cons of serrapeptase. Let's go over the benefits first. It's effective in reducing inflammation and pain and can aid in cardiovascular health by reducing arterial plaque. Is this necessarily proven? I don't think there's a clear consensus, but that's the claim being made. And there is like 20,000 plus people looking this up on Google worldwide every month trying to buy these supplements. And you could tell if you look at them on Amazon, these are selling extremely well. Cons or side effects. There's potential for allergic reactions in some people. Do you know you're allergic to a silkworm intestine gut bacteria byproduct? I don't know if I am. Who knows if I'll get an allergic reaction? There's a lack of extensive clinical studies for any long-term effects. For all intents and purposes, this is more of a holistic medication. So you don't know how you're going to react. It's not necessarily pure. It's hard to say if it is. The recommendations out there for serrapeptase are to start with a lower dose to assess for tolerance and consult a healthcare provider, especially for those on blood thinning medication. I don't think if you're worried about a blood clot or a health condition that necessary serrapeptase is the frontline treatment right now. But that being said, this is why I love YouTube. Some of these videos have a lot more people using serrapeptase than the actual studies out there. I love when you ladies and gentlemen comment in the video. Tell me if you're taking it. Tell me if it works. Tell me if it makes a difference. Who knows? This might be the best thing ever. We just don't have the data right now, but we have to get the data somehow in order to make a logical conclusion on this thing. So I love your feedback. As I was researching this video, I watched a lot of the other YouTube videos about doctors talking about serrapeptase. And the first one that I watched, the doctor said that serrapeptase, he doesn't think that it's absorbed through the intestinal lining. So he thought people were wasting their money. Look at that molecule. That's the tertiary folded enzyme structure of serrapeptase. That's a pretty big molecule, and a lot of the time smaller molecules pass through our membranes, but not something like serrapeptase because it's pretty big. But there actually is a study. In 1994, they did a study where they fed a predetermined amount of serrapeptase to mice and rats, and essentially they measured their blood levels later, and the majority of the serrapeptase did pass through into the bloodstream. So the theory is there is a receptor where the serrapeptase gets grabbed by a vesicle and gets carried into our bloodstream. So it's actually true. It does get absorbed according to rats, but who knows if that's true for humans. I did a deep dive into serrapeptase. It's most well known for inflammation. There was a jaw inflammation study, and it was shown to be effective, but less effective than steroids like dexamethasone. There was a carpal tunnel study, which was effective, but it was a very small study, not really considered to be accurate, but there was 65% improvement. They also compared it to diclofenac, which is an anti-inflammatory, similar effectiveness in the study, but again, small study. And there was a clinical trial during tooth surgery that showed there was less pain and swelling with the serrapeptase. It is also studied as an anticoagulant, but there's not a lot of studies that I could find. Maybe if you guys can find some, I will gladly add them to these videos, but I couldn't find anything too exciting. But in my specific serrapeptase video, there are numerous, and I mean like at least 20, 30 plus people talking about how serrapeptase changed their life almost immediately from taking it after trying so many other things. So that's why I have to include these, and I can't discount these experiences. Nattokinase. Nattokinase is derived from natto, a traditional Japanese fermented soybean dish. Now, the bacteria that ferments this soybean dish, that's what produces nattokinase. So it's not a property of the bean itself. So for example, if you eat like 100 grams of natto, some can be fermented more and have a ton of nattokinase. Some could have hardly any nattokinase. Human studies tend to use around 500 to 5,000 fibrinolysis units daily. It's hard to say how much is present in your natto because the fermentation process can be up or down, but you don't want to go crazy. You don't want to eat more than like 15 grams of natto daily over more than a 2-week period. So you want to eat a decent amount as a side dish, but you don't want to do it every day. You're going to get diarrhea and it could potentially thin your blood too much. That could be a real risk. The specific amount does depend on the specific strain of the bacteria that's doing the fermenting, but there's no specific measurement. I read so many articles, nobody's really come into a consensus. The benefits of nattokinase: blood clot prevention. Nattokinase has been shown for its ability to dissolve blood clots. As a result, cardiovascular health. It supports cardiovascular health by improving blood flow and reducing blood pressure. Now, is this proven? We'll talk about some studies. The dosage ranges from 100 to 2,000 fibrinolytic units per day. Now, I've seen 500 to 5,000 at the same time, and again, I think it's that lack of standardization. The benefits can improve cardiovascular health, especially for people with high risk. And again, these supplements are selling a lot, but the bottom line is, it can help degrade fibrin. It can help with blood clots. Now, the real question is too, is it digested in our stomach or does it actually get into the blood system? Does it have to be injected? That's a whole new story. Sometimes people take supplements that are huge molecules. How the heck do these get absorbed? Well, the answer is large molecules don't. They have to get broken down into their elements or smaller amino acids and get transported through the membrane. So a study just took a look at this like a month or two ago. So I'm actually very impressed how recently this came out. If nattokinase is actually transported into the body, because I always thought, hey, if you eat this large enzyme, is it just digested and broken down and becomes useless and cannibalized for its amino acids? But apparently this nattokinase does bind to some receptors, and what happens is a liposome forms, and it's like a carrier molecule through the cell membrane, and it does actually get into the blood vessels to an extent. It's not a lot of it, probably a smaller percentage of it, so we have to see just how effective it is. The beauty is we do know that if nattokinase makes it into the blood vessel, that it does get in there and it can break up that clot. It is an anticoagulant, so it is very effective. But natto, on the other hand, does have vitamin K2. Some studies do show that 1,100 micrograms per 100 gram unit Even though micrograms are small, that's about 10 times your daily dose. So you definitely don't want to be eating your 100-gram units. So nattokinase is a thrombolytic agent. That's its main thing, more than serrapeptase, and it can dissolve blood clots in studies. I mentioned here 500 to 5,000, but some studies recommend more like 10,000 units per day. I did a deep dive into the new nattokinase studies. So I mentioned a study with 265 people, which didn't show major changes, but there was another study with 1,062 patients. They used 10,800 fibrolytic units per day, and they found that 3,600 per day did not have effect, and this showed significant improvement. And they said if patients were also taking vitamin K2, which is naturally found in natto, then it was even more effective. They reported over about 12 months no major side effects, but there was some criticism that this was a non-properly done study. There was a third study where nattokinase biomarkers were looked at, and it did look promising for the heart, but this is not a robust study. And while these studies are small, there's so many comments in these previous videos about how well nattokinase has worked for some people. Some say it didn't do much, but some say it almost changed their life. The downsides are there's potential interactions with blood thinning medication, not recommended for those with soy allergies. So again, if you're allergic to soy, you might be allergic to nattokinase. The recommendations, and similar to serrapeptase, you want to check with your doctor first. If you have a serious bleeding disorder or on anticoagulant therapy, I don't know if this is the most studied and reliable option. So the comparison of serrapeptase versus nattokinase is serrapeptase is from a bacterial source inside the silkworm's belly. In the studies, 10 to 60 milligrams per day for adults were taken of serrapeptase. This is usually on an empty stomach, not with meals, and the benefits were mainly pain and inflammation. That's where the studies were. Atherosclerosis, I didn't really find any high-level or reliable papers, but I could be missing some, and there could be new ones every day. It's recommended for infections and heart disease risk, but again, I didn't really find a ton of high-level studies. The side effect seems to be very well tolerated, except for potentially some GI upset because taken on an empty stomach. Nattokinase is designed from fermented soybeans. There are some promising low-level studies. For example, the dosage is said to be 500 to 5,000, but previously I showed some studies where 10,000 units were recommended. Some of the studies recommend 12 grams of natto per day for 2 weeks, helps with blood clots, and they even injected a dog, and the blood clot did dissolve within about 5 hours, but then they did do a randomized controlled trial, which was a high-level trial without any real benefits over 3 years of nattokinase supplementation, but it was a smaller dose. So the bottom line is some studies show a lot of potential, but clinically this has not been overwhelmingly proven yet to make any real recommendations. But that doesn't mean there won't be better studies. And you, the viewers, I love your comments and your feedbacks. If you find anything else or you had good results, let us know in the comments and we can look at more details. The primary use of serrapeptase is mainly as an anti-inflammatory and pain relief, so not necessarily as a blood thinner, although it can work as that, whereas nattokinase is more focused on improving cardiovascular health and blood flow. Interactions and side effects. Both can interact with blood thinning medications, so if you're on warfarin or Xarelto or a blood thinner, you might want to be careful with these two. This is the interesting part about all these all-natural medications like Lumbrokinase. The studies varied in dosage from 20 milligrams to 60 milligrams, but you can see that this translates to fibrinolysis units. So the dosage in the milligram amount correlates differently to the fibrinolysis amounts. So there was some differences, and it depends how it's processed, how effective it is, and you also have to consider how well it's absorbed. And I think that's where the studies don't have a 100% answer. And there are some possible side effects like bleeding risks, like allergic reactions, like gastrointestinal issues. But here's kind of the thing. There is a specific study, and I'm going to go over it later, where they did study it across a decent amount of patients. You know, there's always more that's possible, but the studies were pretty safe. There was hardly any bleeding risk because it's a very targeted enzymatic function. So it's not like dropping a nuclear bomb that wipes out all blood clotting. It works on one specific factor. And the allergic reactions were extremely rare, and usually that comes down to how the product is made and supported with synthetic factors like preservatives. But the bottom line is there's never enough clinical data for any medication, even with medications that spend millions and millions of dollars, which this probably does not. Now, the lumbrokinase benefits It has been studied as a fibrinolytic. So the Journal of Thrombosis and Thrombolysis took a look at the benefits of breaking down a blood clot. It did work on a specific factor, and it did safely take down that blood clot risk. So they even did that study with the ischemic stroke patients, and they took a look at breaking down the clot. They combined it with proven anticoagulants, and then they did a separate group without lumbrokinase. The group with lumbrokinase actually had better results. Also, the Chinese Journal of Integrative Medicine showed that your blood was 10 to 30% thinner on average in the study that they performed. So people did have better blood flow. They did improve some ischemic or peripheral arterial disease symptoms. And a separate trial, as we talked about earlier and listed that article, did show stroke prevention. So that clinical trial actually did combine with medication that is proven, and lumbrokinase made it more effective. Further studies showed that lumbrokinase in patients with peripheral arterial disease, when monitored, did show a better ABI test, or ankle brachial index. That means more blood flow was getting down to the toes according to the pressure. And they also measured walking distance, and there was a significant improvement in walking distance or walking length for the patients that were taking lumbrokinase. The American Journal of Cardiovascular Drugs took a look at this and showed that lumbrokinase in the recommended dosages was well tolerated by most participants with a low incidence of side effects. Now, the tricky part is, are these high-level studies? They're probably not. Are they underfunded? They probably are. Are the results pretty good? Man, they sound pretty encouraging for sure. But with all these things, it's hard to make a recommendation because they're clearly promoted. There's clearly a lot of excitement for all these, but no one's really paying for the multi-million-dollar studies to get these FDA approved, for example. So the thing is, lumbrokinase, this is pretty new. I didn't really hear about it until somebody actually brought up the comments down below. If you're taking us, let us know in the comments. This is so interesting, and I'll look up any more studies and add these to these videos as they become available. Personally, Serrapeptase and nattokinase, a lot of patients watching these videos are getting great results, but there's nothing concrete yet showing that you should definitively take it. On the other hand, there is something like turmeric, which is very well studied, and it does have a benefit as an anticoagulant as well. Check out my videos on turmeric and curcumin. Check those out below.